On a daily basis, we get a very sizable amount of our community members coming to our offices and really kind of confused about whether or not they are able to be in Medicare. And realistically, sometimes they are, and sometimes they can be, and sometimes they still have some time to go. But right now, in the months of January through March, it is that special time of the year, perhaps a magical time of the year as far as Medicare goes. It's that time when someone who could be in Medicare or perhaps should be in Medicare and wants to be in Medicare can actually get enrolled in Medicare. So today we're going to be talking about the 5 situations where right now, January through March, you should be applying for Medicare. Hi, I'm Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is that best Medicare option for them during the AEP or really all year round, just give us a call at the information down below and we'll be happy to help them to make those tough Medicare choices. Also, don't forget to like and subscribe. So first things first, let's talk about who is eligible to enroll in Medicare, because it is actually pretty simple to become eligible for Medicare. The main requirements are that one must be lawfully present or resident or a citizen in the United States and live in the United States for 5 years continuously, and must be 65 years or older with a few exceptions. And that's about it, right? Also important to note, I did not mention that you have had to have worked in the United States to be eligible for Medicare, because there is not a work requirement eligibility for Medicare. Full stop. But the cost will be dramatically higher for those folks who meet all the Medicare eligibility requirements but have not worked in the United States for the minimum 40 quarters or 10 years, with exceptions. Why would someone want Medicare? Well, when someone has both Medicare Part A and Part B, they have full Medicare coverage for hospital and medical coverage, but will also have access to those things like Medicare supplement plans and Medicare Advantage plans that do require someone to have both Part A and Part B active to get the full benefits. Things like transportation, Part B reimbursements, money for groceries, and a whole lot more. But those things can only be had with those Medicare health plans, and to get Medicare health plans, you gotta have both Part A and Part B. All right, so let's continue on and talk about the most straightforward people who should be applying for Medicare right now. Which is going to be those folks who are turning 65 years old. Now, if someone's birthday is within the 7-month window, so 3 months before, 3 months after, and the month of, so 7 months, of turning 65 years old, that is when they can enroll in Medicare Part A and Part B. And generally it is done automatically if someone is already collecting things like Social Security benefits. But if they are not, or are still waiting to file Social Security until maybe 70, they may have to actively request that enrollment from Medicare. If someone missed that time frame when they first turned 65 years old to enroll, now, January through March would be the one time of the year that they could request a Medicare re-enrollment in Part A and Part B. If they don't do that by the end of March, though, they may not be able to hop into Medicare again until the following January and face additional penalties potentially if they do. Next up, let's talk about folks who may have Medicare Part A, but they don't have Medicare Part B. Usually there are 2 situations for this. The first is that someone is over the age of 65 years old and is eligible and is working as enrolled in credible coverage through their work, meaning that that coverage is as good or better on average than what is offered by Medicare. In this case, they can choose to leave their work insurance during January through March, that time period, and add the Medicare Part B to their coverage for Medicare Part A. And actually, they are able to do this all through the year. So regardless of when they are doing it, if they have credible coverage through their work, they can hop out of their work coverage really at any time, but January through March is as good a time as any. The second situation is for folks who did not enroll in Medicare Part B when they first became eligible, because oftentimes they got either bad advice or they made a decision that wasn't fully thought out. But sometimes they see that Medicare Part B premium, which in 2025 is $185, is you know what, I'd rather just disenroll, so they don't have to pay that Medicare Part B premium, and they don't have any other credible coverage offered that they are enrolled into through maybe their work or spouse or some other place. Again, this is usually a bad idea. But aside from that, someone does just have Medicare Part A coverage and they need to enroll into the Medicare Part B, they can do that in January through March. If they miss that time frame though, then they will have to wait till next January and also face increased costs when they do eventually enroll, because there is a Part B enrollment late penalty. Another situation that is very common for our clientele is for those folks who only have Medicare Part B, but they don't have Medicare Part A. And this means that they are missing out on a lot of the great benefits they could be eligible for, but need to have both Part A and Part B to have access to. This one is interesting because the only way that this situation shows up is for those folks who have both Medicare as well as eligibility for Medicaid, or Medi-Cal as it's called here in California. For some reason, and my suspicion is money, is that for folks who have full Medicaid coverage because of low income and meet the other bare minimum requirements for Medicare that we talked about earlier, they will get automatically enrolled into Medicare Part B, but often the Medicare Part A part is not automatically enrolled into, even though they could still be eligible for the Medicare Part A portion, regardless of their work history. But luckily, for those folks who have both Medicare and Medicaid and live here in California, only in those months of January through March can they request from Medicare to be enrolled in the Part A portion as well as the Part B portion. And even though they may not have had enough work history to qualify for the free Part A, as long as they have the full Medicaid program, they can get Part A and have it paid for by Medicaid, but only they can request that during January through March if they have the full Medicaid coverage. Once the Part A and Part B become active, then they will also have access to those Medicare health plans that are specifically designed to give additional benefits to folks who have both Medicare and Medicaid, or Medi plans, which is a nice bump in benefits in doctors and in networks as well as hospital networks that may not be available just under when they only have Medicaid coverage. Another situation a person would want to enroll in Medicare right now would be for those folks who have recently arrived in the United States. And I think in practice, this often is for children who immigrate their parents or older relatives from abroad into the United States. Since the basic requirement for Medicare is being lawfully present in the United States for 5 years consecutively, once that time is up, it is possible to apply for Medicare once again from January through March. If they miss that initial window for applying once they reach that 5 years of consecutive living in the United States, they'll have to wait again until January. Most times, up until this point, those parents and those children have had to find alternate other health coverages, either through an employer or a private health coverage or a health exchange or Medicaid or Medi-Cal here in California. But once those 5 consecutive year period is up, that may be a time to examine whether or not enrolling in Medicare may be a more or less expensive than their current option, whichever one they've been making do with. Furthermore, if they have Medicaid, as we had mentioned before, they may also request to be enrolled in Medicare Part A and Part B and have the Medicaid pay for some or all of that cost, which once again will give them additional access to those Medicare health plans and extra benefits. All right, so there you have it. These are some of those prime situations that we see for our clients that could be opportunities to apply for Medicare and get those sweet, sweet extra benefits and coverage perks that come with having Medicare health plans, oftentimes above and beyond what is just covered by the standard Medicare Part A, Medicare Part B, or even employer health plans. But as you can see, it is sort of complicated. It is sort of convoluted and it can be kind of messy, to say the least. So if you or somebody you know has questions about their Medicare health plans, please feel free to reach out to us at the information down below, and either me or my team will be happy to help them in person or over the phone at one of our many offices across Southern California in English or Espanol. So for Michael's Medicare, I of course am Michael, hoping that you have a great rest of your day, and goodbye.